This doctor's been saying what I've been saying for weeks, almost a month now, herd immunity. And we're talking about lockdown versus not lockdown. What's the difference? We're talking about full medical staff. What's the difference before and after? We're talking about normal flu season versus this COVID-19. What's the difference? There's various factors. But the most important part of this is we need to get into herd immunity and get this system out. We've got antibodies going on here. We've got flu going on here. We've got flu shot with the flu going on here. We've got past history. We've got current history. All these factors together are showing something quite differently than the media.
That these antibody testing, antigen testing, it has been, I would say, from a 60% to 90% accuracy rate, which is a broad view. But to your point, and the argument you're making is that counties are seeing different numbers. I know you're in Temecula, so I'm sure you're not unfamiliar with what's going on in San Diego versus what's going on in Kern County. But you still think the number of cases, positive cases, and the number of hospitalizations and deaths is more similar to something like the flu. And so your questioning is, why are we shutting everything down and making, on top of the health matters that are hurting, have it be so economically painful as well?
Well, and the conversation really has to be about herd immunity. So, each year, I've been following flu seasons for 15 years. Every year we have a season that ramps up.
So 15 years and we've got flu shots. Now watch the pattern here on flu. We've got 15 years of records on this.
In December, January, February, it starts tapering off in March. And we have
ramps up in January, February, starts tapering off in March, just like this has.
Have a vaccine for flu. Well, how well is that working? We have in 2017, 2018, we had 60,000 deaths from flu, and we have a vaccine. So the conversation really needs to be about herd immunity and letting that run. So I think a good way.
Herd immunity and letting that run. The body has to take care of this stuff by and large. Has to. I've been saying this for a long time, regardless of what the medical establishment is doing. And now we need to get the medical staff back to where it normally is and let the herd immunity run. Focus on those that are highest at risk and get people back to work. I've been saying this for weeks.
The way to have this conversation is who has done lockdown and who has not done lockdown, and has it mattered? Yeah. So when I look at the data globally, I look at Sweden and I look at California, New York, and the US, and I say one locked down and one didn't. One let it run its course and one didn't. And has that affected the death rate? And the death rate has really been 150 per million for the United States and 200 per million for Sweden. Italy and Spain have 400 per million, and they locked down, which means their death rate was higher. And there's a variety of factors for that. I don't want to simplify it, but what I'm saying is sheltering in place and locking down was supposed to, the point of it was to not overwhelm our hospital systems. Well, in Kern County, our hospital census is very low as I talk to the CEOs, their ICU.
So it's very low. Their ICUs aren't filled. Their emergency rooms aren't filled. They're very low. This is not what's getting out on the news.
ICUs have very few patients. Their ERs don't have patients. They have many beds open. And we're saying, okay, for 2 months, we sheltered, we locked down, we did what was required. Now I think it's appropriate to start easing up and allowing the medical system to bring all of its people back and function at a normal level, because it doesn't make sense to send doctors and nurses home.
And I mean, obviously.
Now that's the question that isn't being discussed. They've sent doctors and nurses home, and they're not even full staffed. And even without a full staff, the numbers are down. There's many beds open in the ICU and emergency rooms. So let's get people back and let's get going.
Trying to compare a New York City to a Sweden is, I mean, you can appreciate the critics that say that's a totally different situation. You're talking about a population with different comorbidities and the density being a little different. So you think maybe California should be treated like its own area, looking
Well,
at the hospital capacity, looking at the death rates, infection rates, than in New York City, right?
Well, not even California. I would say specific counties. For instance, Kern County is spread out. We got 1 million people, and it's one of the biggest counties in California. LA is very population dense, and it's, you know, similar to a New York style of living where people are in apartments and they're crammed together.
So do you think LA should stay locked down for a little longer, LA County, or do you think that it would be safe to reopen LA? I mean, I know you're not saying reopen everything, go back to life as normal. I know you're saying kind of get back into it, slowly reopen things. But do you think LA County should be treated differently than Kern County?
Yeah, and I think a prudent response is taking it county by county and looking at the population density and looking at the medical system in general and saying, is the medical system taxed? In Kern County, the answer is emphatically no.
Again, county by county, is a medical community taxed? And he's saying in Kern County, the medical community is not taxed. It may be different in LA. It's a different population density. But everything needs to be looked at a county by county basis, city by city basis. And you need to allow the people to make their choices and not make a one rule. It's not even a law. One rule fits all. It's just stupid to do that. I'm going to end it here. We need to get going and get things moving, and take it county by county, city by city. And if hospital system is not taxed, put people fully back to work and staffed, and let's get going. Open things up and let's get going. Pretty simple to me. You got to get herd immunity going anyhow. And even with the flu shots, you got to get this virus out in the public. We know enough to handle it and to handle it well. Let's get moving. Good day.